Hello everyone, my name is Ilene Brown and I am a cosmetologist and a certified trichologist. My case study today is on dermotricology in the treatment of atopic dermatitis. My case study is a 33-year-old male. His symptoms started at age 8 and was triggered by soy. At 18, he was hospitalized and was diagnosed with atopic dermatitis. His symptoms included intense itching, dryness, cracking skin, skin pain, stinging, and burning. His type of atopic dermatitis is known as neurodermatitis eczema. He was prescribed steroids after one of his major outbreaks. His disease started spreading during his adolescence and is described as a thick, dark, rough patches of dry skin on his entire body. The steroids stopped the symptoms for a while, but would return when triggered by psychological emotions. After a while, he was diagnosed with overuse of topical steroids. He was using for his eczema, which gave him a side effect of glaucoma. What is atopic dermatitis? It is a chronic disease caused by inflammation under the skin. It is triggered by food allergies. It is asthma-related, which is rhinitis and a fever, and can be triggered by emotions and has a psychological factor. The atopic dermatitis march is thus called because it starts in infancy and continues from teen to adult. 77 to 91% with moderate to severe eczema will have it into adulthood. The pathology of atopic dermatitis covers a wide range of symptoms, causes, and triggers. Some of the triggers are sweat, changes in temperature, stress, dust, types of clothing, smoke, food, long baths, and showers. The symptoms of this disease also varies. There are crusting and cracking of skin, itching and dryness, skin edema, rough and dry plaques. Types of atopic dermatitis that is common are contact dermatitis, which is inflammation of the skin, neurodermatitis, eczema, also known as lichen simplex, and start out as dry patch of skin. Scratching makes it worse. There is approximately 200,000 cases per year. Dyssyndrotic eczema are fluid-filled itchy blisters on the palms and soles of the feet. Nummular eczema, also known as discoid eczema, are coin-shaped spots of rashes and should not be confused with ringworm. Seborrheic dermatitis is a common skin condition affecting the scalp and oily areas of the face, sides of nose, eyebrows, and back. Statitis dermatitis affects people with poor blood circulation due to vein damage. And these are the types of the atopic dermatitis the picture shows. The role of psychodermatological treatments is not only to improve the condition of the skin, but to teach the person with the disease how to cope with the disease and have a better quality of life. In the psychodermatological treatment, all the factors of mind, body, skin, and how stress can affect all three. These psychobiological factors, such as personality, stress, lack of sleep, may play an important role in the pathogenesis of atopic dermatitis. The general objective of my study was to determine if my case study has symptoms of atopic dermatitis. My specific objective in my assessment was to identify redness, itchiness, and to identify the type of skin conditions observed. If there are differential diagnoses for atopic dermatitis, if psycho-emotional conditions contributed to atopic dermatitis, and to assess the quality of life pre-treatment. The assessment instruments used are microcamera, eczema area and severity index, psychodermotricological assessment, Skindex 29, Beck Anxiety Inventory, which is BAI, Beck Depression Inventory, which is BDI. The microcamera is a skin and hair diagnostic system that measures sebum, skin type, hair density, and pores. The psychodermotricological assessment is an analysis of the patient's emotional and mental state at the initial consultation, during the second and third assessment. Beck's Depression Inventory is a 21-item self-report rating inventory that measures characteristics, attitudes, and symptoms of depression. The State Trait Inventory is used to measure trait, and state anxiety is also used in clinical settings to diagnose anxiety and to distinguish it from depression. The Skindex 29 is used to evaluate how the skin condition is concerning the patient regarding their overall appearance and quality of life. Rosenberg's self-esteem scale is a 10-item scale that measures global self-worth by evaluating positive and negative feelings regarding individual self-esteem. My case study assessment results are that his BDI was moderate. He got 3 out of 21. His BAI was 1, which means he has minimal anxiety. The values for each items are summed, yielding an overall total score for all 21 symptoms that can range from 0 to 63 points. And there you have the microcam of his skin. His EASI was 61.8 and his Skindex was 29. The Skindex are questions that target the case study's feelings and skin conditions that has affected him within the past week. The dermotricological assessment underlines psychiatric components. The psychiatric components depends on a good physician-patient relationship, weighing the presence of secondary gain, considering the real and authentic quality of consultation. Also important is the evaluation of the patient's level of functioning and the physical and psychosocial stressors pertaining to the patient's disease. The side effects of psychiatric treatments versus natural plant-based treatments. There are different types of treatments available for atopic dermatitis. Most common are prescription topicals, ointments, creams, and sprays, but one has to take into consideration the side effects of these treatments. The side effects of cortisone is that they may not be used for extended periods. The side effects of prescription drugs can be life-threatening and sometimes emotionally dependent. From some steroid creams like corticosteroids cannot be used for extended periods. Some people develop atrophy, and quite often the disease rebounds after discontinuation. In dermotricology, natural plant-based treatments are used. The natural and balanced formulas in plant-based treatment gives it a high tolerability, which is achieved without side effects. These treatments are made with natural ingredients and are easily adapted by the dermal cells. This allows the skin to heal naturally. There is also the fact that the patient is being treated internally as well as externally. My case study treatment. I started treating my case study in August of 2021. His treatment therapy is in two parts. The first therapy is to reduce the symptoms of the pruritus and lesions. The second is to soften and moisturize the skin. The in-salon first therapy is to cleanse the skin with a normalizing cleanse. Apply K2. Mix 40% turbo and 60% collagen. Add 2 milligrams of fungi active and 2 milligrams of base tonic. Apply to face and body and let sit for 25 to 35 minutes. Wash mixture off face and other areas of the body with normalizing cleanse and pat dry. The second therapy is a hydrating and moisturizing therapy. This is to target the dry, cracking, rough skin. Apply K1 on areas to be treated. Leave on for 5 minutes. Mix base tonic 8 milligram plus BCE plus 1 Revital Pearl plus 1 Shock crushed. Leave on for 30 minutes. Remove without rinsing. Mix together Special K cream plus fungi active and Revital and massage into skin. His at-home treatment is more of a moisturizing treatment. This helps with the fissures and rough skin. Cleanse with normalizing cleanse using room temperature water. Apply K1, then Revital. Mix K1 with Special K along with fungi active. This will keep the skin hydrated and moisturized and will help to alleviate the itching. Take 2 Revital per day and 2 Depure in the morning and 2 at night in a 4-month cycle. And these are pictures of my case study. The pictures of my case study when he started in August. On the left, it shows how his skin has improved compared to the one in August. So we have two pictures here. One of his pictures in August 2021 and the after picture, that's the after picture in November of 2021. Then we also have a picture of his chest in September and a picture of his chest in December. It shows where the fissures are clearing up and his skin looks less dry. The picture dated May 26 was the first picture I took of his face before I started treating him. As shown in the picture of December 21, his skin is starting to heal. His skin is much softer and there is no breaks in the skin. My conclusion. The treatment of my case study continues. His skin has improved tremendously, which has made his quality of life better. The itching has subsided. His skin has changed both in tone and texture. He can now see tattoos that have been covered by the discoloration of his skin. I will be adding capidermia treatments for his face. There is no cure for atopic dermatitis, which is eczema. One can manage the symptoms with different treatments and dietary changes, and working with a health team and following recommendations makes it possible to live a more stress-free life. As his treatment continues, I will be adding more to his case study. Thank you very much for allowing me to present my case study. Thank you.